So you're using PRP with patients that have pain.
Yes, PRP is platelet-rich plasma. So basically we take your own blood, we concentrate it down into the platelets and other growth factors, and then we take it and we inject it into the injured area. So an area that's just not healing, your body doesn't necessarily see it as being injured anymore, it's kind of a chronic smoldering injury. We inject that, it starts the healing cascade again, and you can be healed of things that are kind of chronic nagging injuries. I had a patient in her 40s, early 40s, who had chronic tennis elbow, and it drove her nuts. She worked as a therapist, so she was writing a lot, and you know, it's just daily pain. Within 6 weeks, she was pain-free after I did the PRP injection in her elbow.
Okay, so what are your favorite areas then for PRP, to inject PRP?
You know, I think it works great in tennis elbow, and then the other side, golfer's elbow, which is the medial epicondyle. It works well for partial tears of the rotator cuff, and it works well for knee arthritis, if it's mild to moderate knee arthritis, and it works really well also in the lateral hip. A lot of people call lateral hip pain trochanteric bursitis, but if you look at it under ultrasound, it's usually not the bursa that's inflamed, it's the tendon that's degenerated.
So lateral hip, describe that pain. Like when does it affect you the most?
The lateral hip is you know, the outside of your hip, where if you push on the side of your hip, you feel the bone there. It hurts when you walk. It hurts when you get up. Anytime you're activating the gluteal muscles, especially the gluteus medius and gluteus maximus. So when you go from a seated standing position, walking, lying on that side, a lot of people can't sleep at night because they're lateral hip pain.
So you inject it and
inject it with PRP and follow that with proper rehabilitation, with stretching, strengthening, and it's a treatable problem. When I used to just do cortisone injections, I'd have to repeat them every 3 to 4 months. It would calm it down for a while, but it would come back. The beauty about PRP is that it's actually a healing treatment. It actually heals the problem. So once it's healed, unless it gets re-injured, the patient doesn't come back.